Namaskar, I am Dr. Chawla. I'll be talking on certain aspects of epilepsy for the benefit of patients. Burning questions. One is epilepsy curable? Number one. Number two, what are the treatment options? And number three, can one lead a normal life with epilepsy? In order to answer the question, is epilepsy curable? One has to understand the difference between epilepsy and seizures. Epilepsy is two or more than two unprovoked seizures, which are 24 hours apart. And a seizure is a single event of surge of electrical activity, which can cause symptoms depending on which area of the brain is involved. In most of the primary epilepsies, where the cause is not known, they are generally not curable if the definition of cure is being off medication. But in most of the symptomatic epilepsies or seizures, where the cause can be found, for example, in tuberculosis, in cysticercosis, or some kind of metabolic abnormalities, the epilepsy can be controlled and you can be off the medication. The cure can also be achieved in some of the childhood epilepsies, where after a certain age, the seizures abate on their own. Now, how long to continue the medication? The epilepsy can be controlled. 70% of patients can be controlled with a good combination of drugs and lifestyle management. But there are 30% of patients who, for some reasons, continue to have seizures. They fall into the intractable category. And in them, the cure can be achieved through a combination of drugs, and a small percentage may require some kind of surgery or some newer techniques like deep brain stimulation and vagus nerve stimulation. How long to take the drugs? Generally, after a symptom-free period of 2 years, depending on what are the findings in the EEG, what are the findings in the MRI brain, what has been the medical history of the patient, whether he has been controlled on a single drugs or a combination of drugs, what has been the family history of the patient. So depending on a number of factors, sometimes the drugs can be withdrawn after 2 years if the patient is well controlled and the EEG and MRI are normal. But if the patient has epilepsy for a number of years, in between he continues to have seizures, and there is a positive family history, there are some of the genetic epilepsies like juvenile myoclonic epilepsy, the treatment has to be lifelong. Then the last question, whether the patient with epilepsy can lead a normal life. Well, the answer is a resounding yes. And with a correct combination of drugs and the correct intake of drugs, taking the drugs regularly, having a good sleep and diet and exercise schedule, avoiding triggers, avoiding stress, and usually avoiding alcohol, and avoiding self-medication, and periodically following up regularly with your neurologist, most of the seizures you can lead almost a normal life. And the other question is whether you are allowed to drive. Yes, after a symptom-free period of 6 months, patients can drive a light motor vehicle with due precautions. And the last point, whether the patients epilepsy can get married and have children. Yes, again, if we have a correct combination of drugs which are safe in pregnancy, and you have a correctly supervised pregnancy, the patients can get married and lead a normal life. Thank you.